What procedure will restore my neck and jawline? I'm 42 years old. I was taking a video to track the progress of my Botox. I was horrified by the look of my profile when I played the video back. I have no jaw or neckline. It just looks horrifying to me. I feel like crying. I'm very happy with the rest of my body. It's far from perfect, but I'm happy with it. But this situation with my profile is not acceptable to me. What can I do?
Thank you for your question. You submitted your question with several photos, and you state you're 42 years old and that you were taking video to follow the progress of your Botox, and you became somewhat concerned about the appearance of your jaw and your neck area. And you're looking for some guidance as to what to do in this situation given with the photos you submitted. Well, I can certainly share with you my current approach to helping patients like yourself every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and helping patients with rejuvenation and improving their facial appearance, both surgically and non-surgically, has been the foundation of my practice and has certainly evolved over many years. So when I look at a photo like as you submitted, what comes to me first automatically is to provide an explanation as to what you might be experiencing. Now, if you feel that this is a change or there's a certain shock to seeing this appearance, well, you can appreciate that it is based on a volume loss that is essentially genetic in nature. And that volume loss is mostly at the bone level. As we get older, the bone or the foundational structure of our facial anatomy diminishes in volume. And a lot of times people feel that their skin is getting much more loose and they keep pulling. And at 42, I can tell you that someone like yourself, more of your facial aging change is volume loss than it is sagging. So essentially, when you think of aging, you think of volume loss and you think of laxity. And so a lot of my colleagues, especially those who do a lot of facelifts like myself, you almost automatically feel that it is best to lift and improve the jawline and the neck angle. And although there is certainly a valid consideration, I would say that it is not taking into account the volume loss. And a lot of times my colleagues are trying to compensate for volume loss by doing fat grafting. And the challenge there is that the fat is being placed under the skin at a level that's not at the bone. So in our practice, what I do for someone like yourself is a procedure called structural volumizing. Structural volumizing is actually a non-surgical procedure, and it's with the use of a long-lasting hyaluronic acid filler such as Juvederm Ultra Plus or Juvederm Voluma. Now what we're essentially doing, what I'm doing when I place this filler is I'm not placing it just below the skin the way traditional fillers are typically placed, but rather I'm placing it at the bone level. When you place it at the bone level, you are addressing the true underlying issue of facial aging, which is bone loss. When that happens and it's done in a certain way, you can actually get results that can be not only comparable to a facelift, but in many ways exceeds the results of a facelift because there is volume and definition that you would not be able to get no matter how aggressively you lifted the face. So I have certainly appreciated the remarkable effect and benefit that I've been able to achieve, and it's a real change in paradigm from what I was doing for so many years, where I would work so hard to find the optimal lift that would be as, quote, tight as is maximal at the same time looking natural to get the jaw angle definition, the neck definition. But for people in this age range, in the 40s typically, and as well as into the 50s, this structural volumizing has really become a great strategy to helping people restore or even enhance an area such as the cheekbone, the jaw angle, and the jawline, as well as the chin. It almost looks like you had facial implants, but instead you had injectables done in the course of less than 30 minutes. And it's the kind of thing where there really is no downtime. So I think that since you've had Botox, you can learn about structural volumizing and this strategy, and I think you'll find yourself very pleasantly impressed by the potential outcome. And again, it does take a proper consultation, and when I do my evaluations, I take photos from multiple angles and I look at things at different angles so that I can strategize the volume that would be appropriate to create the outcome that I want to achieve with my patient. So meet with the doctor who performs this type of procedure and see if this is a way to help you feel better about the appearance of your jawline and neck. I hope that was helpful. I wish you the best of luck. Thank you for your question.